Hello, good afternoon, everyone. I'm Dr. Katie Ryder. I'm a board certified adult and family medicine physician practicing at our Silver Spring Center in Maryland. I am excited to be joined today by my incredible colleagues, Dr. Neda Najimi, Dr. Keisha Sullivan, and Dr. Mrinalini Chakukar. We are looking forward to talking to you today about strategies to optimize your sleep habits and pave the way to better health. As a primary care physician for adults and children, I know this topic comes up in my office all the time, and it comes up even for my own family and my own children. So really important stuff. So without further ado, let's have our panelists introduce themselves. Dr. Najimi, would you like to start?
Yes, hi, I'm Dr. Neda Najimi. I'm a board certified neurologist and I'm also a sleep specialist. I see both children and adults, and I work mainly at the Maryland location.
Excellent. Dr. Sullivan.
Hi, yes, my name is Dr. Sullivan. I am board certified in family medicine and sleep medicine. I see both children and adults, and I work mainly in the Maryland area.
Wonderful. Thank you, ladies. So Dr. Chakukar is tied up seeing patients this morning in the clinic. She's going to join us as soon as she's able, and we'll have her introduce herself when she joins. We are looking forward to your questions too. So if you're watching live, please post them in the comments in Facebook. And as we wait for those, let's go ahead and dive in. So I'm going to start with you, Dr. Najimi. Let's get to the basics. What happens to the body and the brain during sleep, and why is it important?
Yeah. So as you fall asleep, your body's metabolism slows down, body's temperature, heart rate decreases, and muscles relax. So during sleep, your body is trying to replenish its energy, repair cells, tissues, and muscles, and also release molecules like hormones and proteins, which can also help growth in children. Hunger hormones decrease during sleep because you're using less energy than when you're awake. Your body also makes some molecules called cytokines, which are also proteins. They fight infections and inflammation. We also dream during sleep. So dreaming happens during REM sleep. Your brain processes information during this stage of sleep, and making it important for learning and memory. So during this episode of sleep, short-term memories convert into long-term memories, and unneeded information that might clutter the nervous system can be erased, and brain gets rid of toxic waste which build up throughout the day. And also brain activity increases in areas that regulate emotion, so that it can support healthy brain function and emotional stability.
So a lot, right?
Exactly, yeah.
Not a passive process. So
Exactly.
We heard the body is resting and regenerating. The brain is getting rid of toxins that build up and consolidating memories that we've learned during the day. Even our emotional health it depends on sleep. So super important in all of the aspects of our health.
Exactly. So as I said, the hunger hormone goes down. So if you are awake, not sleeping at night, it can cause eating more, gaining weight, and increased risk of diabetes, obesity, and other medical issues.
Okay. So yeah, obviously super important. Dr. Sullivan, as doctors, we often will use the term sleep hygiene when we're talking with patients. Talk to us about what that means.
Yeah, so basically sleep hygiene includes having a consistent routine and the proper environment for maximal sleep. So a lot of times when you go online or read articles, they always tend to talk about the same topics, and that's just because they're so important. So one of the things we definitely want to emphasize is keeping on a routine. If you do decide to sleep in on the weekends, we recommend not sleeping over 1 or 2 hours, your normal wake up time. We want to make sure that you are keeping your room at night dark, quiet, cool, because all of those things are going to promote you going into the different cycles of your sleep. We want to make sure that you're not eating too close to bedtime, specifically 3 to 4 hours. We want to make sure that your caffeine intake, is not too close to bedtime, as that can make it difficult to fall asleep. So, those are some basic things that I'm sure you've come across. And, also you can find great resources online and on apps such as CBTI Coach to help you maintain proper sleep hygiene.
Got you. Great. So sleep hygiene is all about, it's optimizing our body, optimizing our mind, optimizing our environment to promote that healthy sleep. The CBTI, can you tell us just what that stands for so people can also look for it?
Yes, cognitive behavioral therapy, and then the I stands for insomnia.
Right.
So, anything that says CBTI will have great resources to help you navigate that.
So an evidence-based method,
Correct.
therapy method without medications, without side effects, to help you learn and help your body learn how to achieve that healthy sleep. Awesome. Dr. Najimi, I think Dr. Shakukar is almost ready to join us, but before she does, I'm just going to ask you, what tips, Dr. Najimi, do you have to help people establish a sleep schedule or improve their sleep hygiene?
So as Dr. Sullivan mentioned, sleep hygiene is very important. So before bedtime, we have to give ourselves some time to have a sleep routine. Like if we want to take a shower, take a bath, relaxation, meditation, reading a book, avoiding bright light, especially blue light, closer to bedtime, which can be from any kind of screen like TV, a phone, iPad. And again, waking up at the same time every day, exposure to bright light during the day, physical activity during the day, but avoiding strenuous activity closer to bedtime because that can give you a surge of energy. And trying to have 3 meals during the day: breakfast, lunch, dinner. And again, as Dr. Sullivan mentioned, try not to eat 3-4 hours before bedtime. These are all the cues that our brain gets from our environment and what we do to help us have a sleep schedule, sleeping at night and being awake during the day.
Great. So yeah, I mean, it sounds like, first of all, just that intentionality and planning and budgeting your day in order to be able to prioritize your sleep and your sleep routine. And I'm hearing you say, really, all the choices that we make through the day can affect our sleep that night.
Exactly.
In order to achieve that healthy sleep, it has to be sort of front of our mind all through the day, not just right before bed. Great. Well, I am going to welcome Dr. Shakukar, who is out in the field helping people get their healthy sleep as we speak. Welcome.
Hello. Hi, everybody. I apologize about the little bit of a delay that I had. My name is Mrunalini Chakurkar, and I am a pulmonary and sleep medicine physician, and I've been working with MAPMG for more than 8 years, and I've been practicing pulmonary and sleep medicine in Northern Virginia area for about last 20 years, actually.
Welcome. Thank you. Thank you. So we were just talking about sleep hygiene and ways that we can get onto a schedule and a routine and things we can do all through our day to promote that healthy sleep. Dr. Sullivan, Let's keep talking about the sleep hygiene. Is there a certain position that is healthiest to sleep in? Back, side, stomach?
Yes, definitely.
Deal.
So, the best side, the best position to sleep in is your side. Specifically left over right, just because of anatomy, where our vena cava and our aorta sit. But either side works. And then after the side, I would recommend sleeping on your stomach. And then the very last thing would be for you to sleep on your back. And the reason for that is because of gravity. When you sleep on your back, gravity causes that airway to collapse much more easier compared to sleeping on your side. Now, there are some individuals who do have, orthopedic issues, right? You have pain in your hips or pain in your shoulders, and you're not able to sleep on one particular side over another. In that instance, I would recommend either elevating the head of your bed with either a wedge pillow, or if you had an adjustable mattress, that should be sufficient also. And you don't have to adjust the head of the bed very high. I would say at least 15 degrees to try to basically fight gravity.
Yeah. Okay. So you can make some adjustments, even if you do need to be on your back for pain reasons or other reasons. Elevating the head of the bed can help counteract some of the gravity issues
Correct.
with our airway. Excellent.
But you also want to make sure that you do not just elevate your head by sticking too many pillows behind you, because you can then obstruct your airway, because then your neck ends up getting folded over. So it needs to be, you need to make sure that your back is also supported.
Gotcha. So the wedge is a nice tool to use, wedge pillow. Excellent. Excellent. How about temperature? I'll stick with you, Dr. Sullivan. Is there an ideal setting for the thermostat for ideal sleep?
Yes, so studies show 65 degrees is best, but really anywhere between 60 and 67 degrees, because obviously there is variability, right? Some people like it a little colder than others. And the reason for this is because when we sleep, our core body temperature actually drops. It actually starts dropping a couple of hours before we fall asleep. And then we actually warm up a couple hours before our normal wake up time. So if you can go ahead and promote that process by just lowering your thermostat, it'll help you sleep more soundly. It will also improve your REM sleep and your deep sleep.
All right. So 60 to 67, find your sweet spot, but on the cooler side. Okay. All right. Dr. Shakirkar, sometimes we have patients come in, or people are experiencing sweating, night sweats, and it's interrupting their sleep and it's bothersome. What advice do you have, or, should people see their doctor about night sweats?
Okay, so it is a very important problem, especially for women in their perimenopausal age. And it can certainly affect quality of your sleep to a great extent. I would say you should do something simple, like, make sure that your bedroom temperature is between 60 and 67, as Dr. Sullivan mentioned. Shouldn't have, you should have turn your fan on. Those are the simple things to help. Some of the new memory foam mattresses, which are very popular, they tend to retain heat, and that can also make you sweat a lot. So maybe not using a memory foam type of mattress, switching to a different type of mattress, or cooling mattresses are an option. Sometimes, along with other menopausal symptoms, if your symptoms are very severe, you do need to see your OBGYN to discuss your symptoms and discuss treatment options. Rarely, it can be an indicator of serious illness, especially if you have associated symptoms like fever, you're losing weight. Things in that case, it is very, very important for you to see your primary care physician and get additional testing done to find out why you're getting night sweats.
Yeah, I agree. So soaking night sweats associated with fever, weight loss, or fatigue, definitely see your primary. Menopausal symptoms that are happening during the day and through the night that are keeping you awake, very good reason to see your doc. Otherwise, managing your environment can go a long way if you're finding you're just sleeping hot. Got it. All right. I'm wondering, Dr. Najimi, are there certain, again, coming back to the sleep hygiene topic, are there certain foods that or drinks that can help you fall asleep? And on the other hand, we talked a little bit about caffeine, but any other things that we should avoid, in the hours before bed?
Yeah. So in addition to not eating 3-4 hours before bedtime, it's important also if you have acid reflux issues. So you should avoid greasy food, spicy food. Instead, trying high fiber food can be helpful, like oats. They also are a good source for tryptophan, which is a precursor for melatonin and serotonin. And also avoiding foods that have high sugar content. In addition to caffeine, also we have to avoid alcohol closer to our bedtime, because alcohol initially can be a hypnotic, which will help you fall asleep. But then as the alcohol starts to metabolize, its byproducts can keep waking you up in the middle of the night. And going back to the caffeine, sometimes people think caffeine is just coffee, but it's also black tea, green tea, white tea, sodas. Most of the sodas have caffeine in them. So when we purchase a soda or any kind of drink, we can take a look at the caffeine content of it. And yeah, I think trying these can help you have a better sleep.
Great.
Yeah.
Thank you. Thank you. So yeah, careful with that nightcap, huh? Alcohol may think it's helping, but it's actually interfering later on in the night. Okay, let's see. How about supplements? I'm going to give this to Dr. Charkukar. Are there, so we see a lot of, if you go to any drugstore or look around online, we see supplements for sleep. Are there any that you recommend as safe and effective, or what should we know about supplements for sleep?
The commonly used supplements for sleep, and I'm not going to talk about the over-the-counter hypnotic medications that are available. I'm not going to include that in this group, is melatonin, ashwagandha, magnesium, calcium, magnesium combination. As far as melatonin is concerned, as I'm sure you are aware by now, it is naturally produced by the body, and in most people who are blind due to retinal diseases cannot produce melatonin, but everybody else does produce melatonin. Melatonin production does get decrease with older age, like people who are much older patients, they don't have normal secretion of melatonin. Melatonin is also a regulator of circadian rhythm. So taking melatonin is used for adjusting the circadian rhythm as well. But a few things that you have to be careful about is most people, like if they follow the sleep hygiene that we discussed, will make their own melatonin, and they don't need to really take a supplement. When you have, like if you have traveled internationally and you have a jet lag and difficulty in falling asleep, melatonin is very useful in those people. It's in shift work patients, the people who do night shift work, for them, melatonin is not found as useful in the studies. It is a very mild hypnotic. That means it helps you fall asleep. It does not really help you stay asleep. And I don't recommend starting it routinely, especially for people who have other medical problems and they may be on other medications, because like everything else, even melatonin can interact with some of your medications, especially those used for high treatment of high blood pressure. So you should always discuss that with your primary care physician to see if it is appropriate for you to take melatonin. Um, Magnesium and calcium are both regulated by your kidneys, and people who have kidney diseases should not be taking these medication without discussing with their physician beforehand. In people who have normal kidney function, taking magnesium, if it is not going to be harmful, may not help much, but may not be harmful. Again, as far as ashwagandha is concerned, has become recently very popular as a medication to help you sleep and help you deal with stress. This medication also has a lot of drug interactions, and especially people who are on medication need to discuss it with their primary care physician, make sure that it is appropriate, and you should not take the medication without having discussion with your primary care physician about their appropriateness in that particular situation.
Mhm. Okay, gotcha. So we're hearing melatonin may be helpful, certainly good use in when your circadian rhythm may have been disrupted by jet lag or something like that, but hasn't shown to be very beneficial for shift workers who are constantly potentially adjusting their circadian rhythm. And then just making sure that we discuss starting supplements if you take medications, discussing that with your primary care doctor to ensure that it is safe. Thank you. I want to shift gears a little bit and just talk about some of the conditions and some of the things that can interrupt healthy sleep, even if you're working hard on sleep hygiene. And Dr. Chakrakar, you mentioned shift work. So people who are working nights and different hours through the day where it's hard to get onto a routine. Dr. Najimi, what advice do you have for patients who work nights or variable shifts?
Mm-hmm. Yeah, so shift workers usually have sleep problems because they have to fight the regular circadian rhythm of the body, and it's hard to get enough sleep during the day most of the time. So if it's not taken care of early, it can cause chronic insomnia in the future. And so what we need to do is, it can be difficult, but we have to try to keep the same schedule on the days that, on the off days as well. So going to bed and waking up at the same time, because we don't want to be very different from the days that we work. So we have to help this with doing light therapy, exposing ourselves to bright light when we wake up to go to the shift at night. And we can drink coffee, taking a short nap before starting work. If it is possible to take short naps, like 10-20-minute naps in between work, if the schedule allows. And as Dr. Chakrakar said, studies have not proven completely the use of melatonin to help stay asleep, but it might be helpful at low dose to help them fall asleep in the morning when they go home from work. And they have to make sure that the environment that they're sleeping is dark, comfortable. They talk to family members that considering keeping a quiet environment for them to sleep, because they can actually wake up easier than a normal sleep. These are the things that we can do to help them cope with the night shift. And if these are not helpful, then sometimes we can go ahead and use some wake promoting agents to help them stay awake during the night shift. It's even more difficult in people who are having rotating shifts. So it's very difficult to cope with that schedule. So it's recommended if they are doing the rotating shifts that the rotation is done clockwise, because coping with that is easier than if the shifts are rotating counterclockwise.
Okay. So working later as time goes on and then coming back is what you mean. Yeah.
Exactly. Yes. If it is a job necessity.
So again, coming back to sticking with a routine day to day as much as possible, the hours that you sleep, remaining consistent, protecting that time and holding family and friends accountable to protecting that time. That can be tough for night workers.
It is.
I have patients who, that's hard. Thank you. Those are all great tips. So again, continuing with some of the things that can interrupt or get in the way of healthy sleep. Dr. Sullivan, a lot of patients certainly come to me, and I'm sure all of you, talking about, it's just hard for me to turn my brain off. My thoughts, as soon as my head hits the pillow, the thoughts start racing. What advice do you have for that issue? Comments?
Yes. So a couple things. One, a patient can either keep a sleep diary or journal. So a lot of times we lay in bed and we think about what we have to do the next day, right? And you just keep, repeating it over and over again, hoping that by the time you wake up, you don't forget. That sleep diary or journal, you just put it on your nightstand. When those thoughts start occurring, just pick it up and just jot them down. So that way, when you wake up, they're safe. They're there. Everything you have to do is right there in that journal. Other things that are simple are just some breathing techniques. You can also do something we call progressive muscle relaxation. You start at the top of your body, and every, muscles, your eyes, your cheeks, you want to contract them for a couple seconds and then relax all the way until you get down to your feet. There's white noise, which we're all familiar with, and also brown noise that you can play in the background to hopefully calm some of those racing thoughts. In addition to just podcasts, sometimes people do a great job at falling asleep listening to, I would recommend like a podcast related to sleep or something that's a little, mundane, but just, somebody else's voice, just talking in a monotone manner can really be helpful in putting you asleep. And usually those, usually those sounds help kind of drown out your own thoughts.
Gotcha. Yeah. So I'm hearing something that can, first of all, unload the thoughts. So the journal, just unload them onto paper so they're not swirling in your head. And then techniques to, first of all, get your mind focused on something other than all the racing thoughts, podcast or a breathing technique or a relaxation technique, to just quiet the mind and help to calm the body. I've certainly recommended those to patients, and they, what I would emphasize is they are skills, right? So like relaxation techniques are skills that improve as you practice them. So they become more effective the more that you practice them. So even if you're having trouble, you've never done, progressive muscle relaxation or a breathing technique, keep working on it, because as time goes on, you will hone that skill and it will become more effective for you. And again, so much better to do this on our own without the help of medications that may have side effects and stuff like this. The goal is to be able to achieve that sleep on your own. Let's see. Let's talk about pain. That came up already a little bit in the way that pain can affect sleep. Dr. Najimi, what advice do you have for patients for whom pain is interfering with their sleep, chronic pain?
Yeah. So first of all, you have to see your doctor to find the source of the pain and treat the cause. The treatment can be medication, non-medication, and you can consider taking the medication if necessary before bedtime to reduce the effect of pain on your sleep. The other things that can help is making sure your bed is comfortable, the position you're sleeping is comfortable, meditation, relaxation, breathing exercises, all of these came up during our discussion. And some people experience pain only at night, and this can have multiple reasons, and one of them can be restless leg syndrome. So definitely consult with your physician to find out the source of it.
Got it. Thank you. Thank you. You may have heard Dr. Sullivan, you may have heard that fire drill happening in the background. So she's going to stay safe and let herself out. Let's see, we've got a few more minutes. Dr. Shakrukar, talk to us a little bit about the common sleep disorders. What should prompt people to see their doctor about a potential sleep disorder? Things that they're noticing, symptoms that they're having.
Sleep disorders are very common, and population-wide, I would say at least 20 to 25% of the patients have some kind of sleep disorder. Not being able to fall asleep or not being able to stay asleep, that means waking up in the night and then not being able to go back to sleep, is it's called as insomnia. It's a very common symptom seen in about 10 to 15%. I'm sure all of us have had insomnia in our life at some point or the other. It can be an indicator of stress. It can be a indicator of a grief reaction to a death of a loved one, or it could be situational related to stress, or it could be chronic. If this is lasting for more than 3 months, then it is chronic. Now, chronic insomnia can have significant consequences to your health, and it also increases the risk of depression. So if you have chronic insomnia, you should seek medical advice. We have Dr. Sullivan had discussed about CBTI, or cognitive behavior therapy, which is very effective in managing chronic insomnia, and treating insomnia also decreases the risk of developing depression. It can also, these things are also seen along with other psychiatric illnesses such as depression, bipolar disorder. So in those patients also, it's very important to control. Sleep apnea, I would say, is the second most common sleep disorder. And sleep apnea affects overall, I would say, 10% similar amount of population, close to 10%. It's seen in older patients, so older patients tend to be more affected by it. And the symptoms usually are snoring, for daytime fatigue, and sleepiness. Now, women usually will not complain of sleepiness in the daytime. Their symptom is mostly fatigue. They're just so tired in the daytime. They can't get through their work day, or if they can get through their work day, they can't do anything else other than other than their work and things that they must do. They cannot. So that would be an important symptom to seek advice, especially for women. Women, it tends to be a disease of perimenopausal and postmenopausal age group. In older patient, more increased forgetfulness because of there is a relationship between your sleep and memory. So increasing forgetfulness. Also, we know that There is increased risk of memory loss in patients who don't have a good quality sleep, either due to insomnia or sleep apnea. So these are the falling asleep in the daytime, falling asleep at your work, you are in a meeting and the screen is dark and you fall asleep. That's not normal. You need to seek advice from your primary care physician. Falling asleep during driving. Again, it's a very serious symptom when you're waiting for a traffic light to change and you end up taking a quick micro nap. Then it's a very serious symptom. You are at risk of for having a motor vehicle accident and involving yourself and other people. So very important to seek medical advice if you get such serious symptoms.
Mhm. Gotcha. So we're hearing certainly chronic insomnia lasting more than 3 months. You should talk to your doctor, and then snoring or any signs of excessive daytime sleepiness, excessive fatigue. Those are absolutely reasons to get checked out and make sure that you're not dealing with a sleep disorder. Thank
Exactly.
you.
Yeah.
Yeah.
So I'm just going to add one more thing. In children, sleep apnea can present very different from adults. So they can become very hyperactive, and they undergo workup for ADHD and other problems, which the underlying issue might be sleep apnea.
Mhm.
Yeah, just wanted to add this.
Thank you. Yeah, I appreciate that. So yeah, school issues, hyperactivity, snoring will happen in children as well if they are struggling with sleep apnea, and it can really impair their learning and their functioning. So also important to check that out with their pediatrician if you're noticing those things. Well, we are coming up on time here. I have really appreciated all of the information that you pros have shared. I don't think we got any questions from Facebook, but hopefully everyone has enjoyed our session today. Thank you so much for tuning into our Facebook Live event. We have lots of information like this on a variety of topics on kp.org/doctor. And from all of us at Kaiser Permanente, we wish you well and have a wonderful rest of your week. Thank you.